I'm Dr. Stacey Halum. I've been in practice in the field of laryngology, which is a subspecialty of otolaryngology, since 2005. I chose to become a laryngologist because I thought I could really make a difference in the quality of life of my patients. When I was a medical student, I was able to witness a surgery where Dr. Charles Ford at University of Wisconsin-Madison inserted an implant into the larynx of a patient and literally turned the patient's voice on. The patient had no voice and walked out of that operating room with a nice, strong voice, able to communicate with others. And as soon as I saw that, I knew that is what I needed to do. That was the field for me. So I have really enjoyed making a difference in the quality of life of my patients, giving them their voices back. When I meet you for the first time, one of my major goals is to treat you the way I would want to be treated if I were a patient. We do a lot of procedures in my clinic, and those procedures are very minor, they're very painless, but it's important that we are able to do some procedures so that we can get a good evaluation of the vocal cords. So one of the procedures that we typically do on the first appointment is we numb the nose up. We have a tiny scope that runs along the nose, and it goes to look at the back of the throat and at the vocal cords, and we actually have the patient's voice as we do this, so we can see the vibration of the vocal cords. That being said, I've had this procedure done to myself numerous times, and I have tolerated it extremely well. It's not a painful procedure. I've had all of the procedures that we do in clinic done to myself because I think it's extremely important that physicians know what their patients are going through. And they are all very tolerable procedures. However, they allow us to get a really good evaluation of the vocal cords, and then we can decide what's the best treatment for our patients. Is it better that they undergo therapy? Is it better that they undergo medical treatment? Is surgery indicated? Sometimes it's just a combination of those, but we work with you as the patient to decide what's going to be the best treatment. So I'm actually a clinician scientist. I've had a basic science research lab alongside my clinical practice now for 15 years. And we do stem cell research, which I think is going to be the future of medicine. So one thing I'm very passionate about is the idea of translating from bench to bedside. I would like to be the first to bring some of these stem cell therapies to the field of laryngology and to help our patients directly with these new research breakthroughs. I also feel that's extremely important to stay up on the latest and most up-to-date treatment practices. So I go to all the national meetings. I'm very involved with our national organizations on a laryngology level, and I hope that allows me to give the most up-to-date care for my patients. So when I'm not working, I enjoy spending time with my family. I am very blessed to have a wonderful husband, 2 beautiful boys, and we spend a lot of time doing activities, whether it be playing basketball, playing tennis, boating, or fishing. We just like to be outdoors.